that I made to my dad. And this is the way I phrased it to him. I think I might have a drug problem. When the reality of it was, I was a full-blown dope fiend.
Nine months ago, I found out that my youngest daughter, who's a nurse, has a prescription drug problem. I've been helping others with it for years. I never imagined or dreamed that it would have happened to me.
He was driving a truck and he turned the truck over onto another truck and killed two men.
Wow, I don't get out of bed unless I'm going to get high. You don't see me unless I'm high.
It's not that I didn't care about others, but it just, when it hits in your own home, it changes everything.
My husband had a back problem and he started getting prescription drugs to deal with the pain, and he became addicted very quickly to Oxycontin.
It was colorless, odorless, you know, unless I had pill residue falling out of my nose. Nobody ever knew I was high. It was my mom, my dad, my brother, everything. It was the most important relationship, probably to this day, that I had ever had in my life.
Here in Southwest Virginia, we have found ourselves with a problem primarily concerned with young people and how it's affecting families, and we realize it affects more than just young people, though. It affects our adult population.
1999, we saw basically a revolution in drug use in this area. It completely changed the culture of Southwest Virginia.
I've never had to deal with the types of addictions, though, that I've had to deal with over the last several years. At one point, we used to see a limited number of deaths in this region due to prescription painkillers or substance abuse. Those numbers have skyrocketed.
It involves everybody, you know, because if I'm addicted, I'm going to touch the person that lives next door to me. I'm going to touch my cousin that lives over in the next town. I'm going to touch the person that lives down the street 5 miles.
You begin to question everything that the person tells you.
The fact of the matter is, I hurt everybody around me way more than I ever hurt me. See, I knew I was killing me. Everybody else had to watch it.
Any assistance that you try to offer that person, are they going to abuse the assistance that you give them?
I basically went from being a kid who knew nothing about drugs to, realistically, within a year's time, being a full-blown drug addict.
The parent would say, I don't know what's happened to my child. They're not acting like they used to be.
I started writing bad checks. I started lying to everybody around me. Kept getting arrested for really, really stupid things.
A lot of times they would say they were raised right. She was a cheerleader, he was a football player.
I had scholarship offers to play college football. Passed all that up.
It's a difficult time in our community, but it's also very exciting because we are beginning to take a stand for what we think is a critical need in our community.
But I'm proud of the fact that our region in Southwest Virginia and really in Central Appalachia has really come together and begun to coalesce around this problem.
Coalition work can be really hard. And 10 years ago, when we came together and said, what can we do about the prescription drug problem, we decided to come together as a region, and we formed Appalachian Substance Abuse Coalition for Prevention and Treatment. And that coalition serves 8 counties, and they of course have their own coalitions as well. But we thought we needed to take a leadership role in helping to kind of pool all of our resources together and all the professionals and partners in the community so that we could effectively address the problem and kind of pass it down to our coalition specifically in the counties. In order to effectively organize our efforts, we followed the Center for Substance Abuse Prevention's Strategic Prevention Framework. This has allowed us to really effectively assess our community, look at our capacity, plan together, implement programs, and more importantly, evaluate what we're doing to see if it makes a change.
As a school system, we've worked very hard to develop science-based prevention over all of our grades. Last year in our community, 43 people died from drug overdoses, and none of them were teenagers. something we're doing is working.
It has grown from 8 people to 145 people wanting recovery, wanting to know how they can stay clean.
Our church is used 7 days a week. Everything from financial counseling to mothers who have kids that they're concerned about in school prayer groups, whether it's AA groups or NA groups, Boy Scouts, any type of ongoing youth program or children's ministry. If we can fill their time with things that are good, it leaves less time for them to be doing the things that are bad.
The thing that we're most proud of, I guess, is this media campaign, because we really want people to know what the problem is, to know what the resources are, and to know how they can get involved for their need, whether it be professional or personal, or maybe a recovering person or someone seeking treatment.
This community's been sick for a long time, and it's about time we heal. And it's possible through all the help that we have here.
It's unbelievable what we do. So I'd like to encourage you to be a part of that as a citizen in Virginia.
Being involved with the coalition gives me the incentive. It gives me a sense of purpose. It gives me the courage to keep going, because it's not an easy road.
It's just amazing how this community has changed. And I'm glad that I live here now. And just in case there ain't nobody told you today that they love you, I do, and there ain't nothing you can do about it.
I don't care if I drink and drive.
I don't care if my parents use drugs. It doesn't bother me.
I don't care if I shoot up drugs.
I don't care that my dad can't keep a job.
I don't care if I snort pills.
I don't care if I smoke pot.
I don't care if you smoke pot.
Who cares if I stole drugs from my grandmother's medicine cabinet?
Actually, we do care.
You want to know why?
It's our community. It's our responsibility.